Have you ever wondered who in your gym is using HGH or human growth hormones? What are the possible signs that you can look out for, or changes that may indicate that someone is not a natural and actually using illegal substances such as HGH? Hi, my name is Dr. Aziz. I'm a physician based in the UK. Welcome back to this channel where we cover health, psychology and life hacks. In this video, we'll be covering some of the possible telltale signs that someone is using human growth hormone. Number 1, the face. Excessive growth hormone can cause enlargement of bones everywhere, but nowhere are these changes more noticeable than the face. You can get prominent eyebrow ridges, something known as frontal bossing. Excessive growth hormone can also result in a broad nose bridge, prominent nasolabial folds, thick lips, and gaps between the teeth. The chin can extend out and the jaw can also protrude outwards in something called mandibular prognathism. Number 2, puffy face and abdomen. Similar to anabolic steroids, growth hormones can cause fluid retention, resulting in at times quite unattractive puffiness, both in the face and abdomen. Number 3, hand enlargement. Next, look at the hands. A feature of excess growth hormone use, either exogenously administered or in the medical condition called acromegaly, where the patient has excess growth hormone, is that the hands are very large. Of course, hand sizes do vary like anything else, but if someone has gigantic hands or shows an increase in size of the hands, then you can suspect HGH use. Number 4, feet enlargement. Similar to the hands, the feet also enlarge. So without being weird, if you take a peek at their feet and they're looking quite ogresome, then that could be growth hormone use. Number 5, cardiomyopathy. Growth hormone can result in enlarged organs, the most crucial of which is the heart, something called cardiomyopathy. Key signs of someone with cardiomyopathy can include breathlessness, high fluid pressure, and fluid accumulation. Interestingly, these are some of the signs and symptoms that both Ultimate Warrior and Aziz exhibited in the months leading up to their deaths, and you can watch their autopsy reports on this channel, which I'll link below. I'll also put a link to the video on heart failure, which can be a result of cardiomyopathy. Number 6, signs of diabetes. Excessive growth hormone increases the risk of diabetes. Some of the key features of this include blurred vision, but also polydipsia, excessive thirst, and polyuria, excessively going to the toilet. Number 7, at its worst, growth hormone can increase the risk of cancer. Growth hormone stimulates IGF-1, which itself stimulates mitosis, i.e. cell division. Cancer is essentially unproliferated cell growth. Now, the development of cancer is a multi-step process with many factors, something that goes beyond the scope of this video, but certainly growth hormone abuse is one of many risk factors for cancer. Number 8, acne, huge muscle mass increase, and man-boobs. Now, gym goers use these substances are unlikely to use HGH on its own. More often than not, they use it in combination with anabolic steroids. HGH and anabolic steroids augment one another, and we can see all the typical signs of steroid abuse. If you haven't watched the video on how to spot the roider in your gym, click on the right now and you'll soon be able to tell who the juicer in your gym is. Anyway, I hope you found that useful. Do you know anyone using HGH or growth hormones? What signs have they shown? Do comment below. If you want to keep learning about psychology, health and life hacks, then make sure to hit the like, subscribe and notifications button. Until next time, stay safe.